There's so much at stake today in Minneapolis, and joining us now to talk about that is Rev Janae Bates, the Director of Communications for Yes for Minneapolis. She's here to talk about the vote and this proposed measure to replace the department. Now, I just want to put this out there, Rev Bates, just to be clear for all of our viewers at home, you do not call this measure a defund the police measure, yes or no?
No, we do not.
Okay. I wanted to make that clear because, again, we have these conversations. First of all, none of us who live outside of Minneapolis could by any means understand all that you all have gone through. This community has been reeling for a number of reasons. So can we talk a little bit about what this measure is? What is the goal of this proposition?
Yeah, the goal is really to keep people safe. The reality is in the city of Minneapolis, we have a fully funded police department, regardless of the fact that we are down officers. We are still paying for those officers, though many of them have left the service. And so what we know is that many of them left because they've said they felt too stretched, that they are called to be social workers and homeless outreach and substance abuse specialists, and that is not what they're qualified or trained to do. And so what replacing the Minneapolis Police Department, that container, replacing that with an expanded Department of Public Safety allows for police officers to work alongside folks like mental health professionals, social workers, homeless outreach coordinators, in order to keep everyone safe. It also changes the structure that is currently in Minneapolis, where currently the Minneapolis Police Department is the only department in the city that has what's called unilateral mayoral control, which really allows for things like policy measures to be done behind closed doors. And so by changing the structure to match all of the other departments in the city, we can have an actual ability to have transparency and accountability with those who protect and serve. But there are absolutely going to be police officers a part of the department. In the state of Minnesota, it is a mandate that officers respond to a whole series of situations. And so this is most certainly about making more possible and more resources for the people to stay safe.
And Reverend Bates, I hear your heart in wanting to have officers be trained specifically for mental health episodes and for those who are really at their wits' end or on medication or on drugs and need someone with that kind of experience. You have this thing called data-driven community engagement as a process laid out in the proposal. How will that determine how many qualified health professionals would need to be hired within the police department and how many officers remain on the force with more traditional training?
Yeah, that is a great question and one that has a great answer. The reality is currently we're working on a model that was created by the Police Federation in 1961 that says that we can only have an armed police only response. So what we'll get to do by voting yes today is that the people of Minneapolis will get to have a data-driven process. That means that we'll get to look at the data, the 911 calls that come in. Law enforcement has already named that the majority of calls that come into 911 are actually not law enforcement related, though they are the only ones who can respond. And so by matching the actual safety needs of the city with the qualified professionals that we really need to keep the city safe, that's what we're looking forward to having. This is really about just updating the charter so that, like most cities across the country, the city of Minneapolis will have nimbleness around staffing and budgeting and be able to deploy people to the right situations at the right time.
It sounds like something that a lot of communities are asking for in terms of policing reform. But again, like we cannot put ourselves in the shoes of those who live in Minneapolis and what you all have gone through emotionally and psychologically over the past couple of years, then we cannot necessarily put ourselves in the shoes of police officers who are confronting some of the folks who need to be taken into custody, albeit maybe in a different way. You've said in this proposal that while the transition takes place, the police department will continue day-to-day response until there's this smooth integration. So what will happen exactly? Is this proposal saying that many law enforcement officers will not use guns, for an example? They will use other types of restraints? Can you just be really specific about the solutions here?
For sure. Yeah. So we know that police officers, who are also called peace officers, are trained and licensed, and most certainly they carry a gun. And quite frankly, there are times within the city where you call 911 and that is exactly who you need to show up. And so nothing about this amendment changes that. What we are changing, though, is like many cities, there are actually a lot of calls that come in where people are experiencing a crisis and they just really need a mental health provider. And so we're modeling this off of a lot of the successful programs that we've seen across the country, like the STAR program in Denver, where they were able to divert almost 800 calls to a medical team who did not need to have any co-response with police officers in all of those calls. No arrests were necessary in all of those calls. So this is really just a way to invest in communities and to invest in the resources that they need, and most certainly to assist those police officers who are doing these hard jobs day to day. And they most certainly need to be deployed into spaces where they're well trained and disciplined to do those things.
Well, and there are critics of the measure. And while I hear what you're saying, they're saying that your proposal actually has a broad elimination of a number of officers, again, reducing the number of officers and possibly sapping resources from the department. So what do you say to those folks, and why not create another department to work alongside the police?
Well, actually, that particular point is disinformation. Nothing about this amendment would remove any number of officers. As a matter of fact, the city has addressed this directly, letting police officers know that their contract remains, that their jobs remain in place. What this actually does is expands public safety so that we can add the qualified professionals that are needed, but it does not remove officers from their role, power, or position.
One more question for you, and that is, are you intending on adding officers, these Department of Public Safety officers who have the mental health training? And really, are you expecting those who have only had traditional policing training to now change completely to a different kind of officer? And how easy do you think that's going to be?
Yeah, for clarity, what we're actually doing is expanding the type and the mix of qualified professionals in the department, not necessarily expanding the role of policing. We have found that police officers should actually be really qualified and trained in their wheelhouse, in their work, and asking them to also have all of these additional trainings is one of the reasons why we're finding that they're being stretched and overtaxed. This is really about supporting them and supporting the city with the actual qualified professionals who do this work every single day, and should be deployed into these situations that really call for their services.
It is not an easy job to be a police officer in this day and age. It is not an easy task to come up with solutions. And we know that the voters will decide on this proposition, this proposal today. Reverend Janae Bates, I want to say thank you to you. I definitely hear how passionate you are about coming up with answers that help everyone in the community. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.